Hi, I'm Russ Duerstine, Executive Director for Concerned Veterans for America, and it's my pleasure to introduce you to the CVA's inaugural congressional conversation. And our very first guest is Senator Marsha Blackburn, so thank you for joining us.
Yes,
Say a little
I'm
bit about
delighted,
yourself. Yeah.
absolutely delighted to join you, and so thrilled to represent the people of Tennessee here in the U.S. Senate, and of course to be able to serve on the Veterans Affairs Committee.
Outstanding. You've been a longtime champion of veterans,
Of course.
a great friend to CVA. We really appreciate your vote for the 2018 Mission Act.
Yes.
It was monumental in our advancing choice in a broken VA healthcare system. I want to focus a little bit on the Tennessee-Texas connection. I live in West Texas, and of course, I don't think there is a Texas, so the Tennessee volunteers don't come down and help us. But we have a commonality, and your state is home to over 453,000 veterans, if I got my state stats right.
That sounds right.
And you've got tremendous bases there. My son was stationed at one of them. He loved his time there in Tennessee. How does Tennessee's tradition of service shape your work as a member of the Senate Veterans Affairs Committee?
Well, you know, we are known as the Tennessee Volunteers.
Yes.
And the volunteer state, and that is deeply rooted in our heritage. And of course, it ties back to the War of 1812. And Tennesseans have always shown up, and indeed there would not be a Texas without Tennessee.
Absolutely.
And we like to take credit for the good work that we have done there, and of course the shared history and legacies and of Sam Houston,
Yes,
and others that are also there. But veterans are a big part of our community. You just talked about the veterans that are there. And in Tennessee, with the fact that we have so many active duty that are there, whether it's the Millington Naval Air Station over outside of Memphis, or Fort Campbell, as you mentioned, which is primarily in Tennessee.
Yeah,
that's right. That's it. That's it. Gate 1.
Right.
Everything else is in Tennessee.
That's right.
And it was known as Camp Campbell, Tennessee. And then you have the Arnold Air Station. It's the Arnold Air is a part of the Air Force, and Arnold does the hypersonic testing, the wind tunnels, all of that's out at Tullahoma, and of course we can't forget our national labs, and we have the Oak Ridge National Lab. And Tennessee has a very aggressive program with the National Guard. And indeed, the National Guard's full-time intel unit is located in Nashville.
That is outstanding. Not only do so many veterans come enlist from Tennessee and in Texas, but they come home to live there as well. And that's why you have such a large veteran population. What a great place to, after you serve your time, come live in a great, beautiful state like yours. Let me focus on some policy and something controversial that came up not that long ago. You know, veterans feel oftentimes they're trapped in a socialized healthcare system.
Sure.
And it's hard. And one of the things that we saw the president do was claim that, you know, this LSG, Limit, Save, Grow legislation was going to cut benefits or cut money or care going to veterans. It's a position we disagree with. But what were your thoughts on that, and how do you see the VA having to deal with its budget issues?
And I found it so interesting that the first thing the president would say about the debt ceiling proposal was that it would cut veterans' care.
Yes.
Because we are constantly working with the VA trying to have them meet their obligations.
Right.
And there's nothing in the debt ceiling legislation, nothing at all, that would have an impact on veterans' care. What is having an impact on veterans' care is that the VA has a tremendous number of backlogged cases.
Absolutely.
You've got, I think there are like 260,000 in their backlog, and they've recently added like another 500,000 claims that are coming in because of the PACT Act. And they told us that they weren't equipped to handle the PACT Act. And this is what is keeping veterans from getting care. The fact that in Tennessee, a veteran's got to wait 100 days to get a primary care appointment. And these are the things that are impacting veterans' care. It's not the debt ceiling belt, but you know, this administration is very intentional in how they try to demonize anything that is going to bring restraint to the federal government. They want to continue to just grow, grow, grow. They've added about $6 trillion to the debt since they took over. They have continued to just print money and spend, 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 and they feel as if they can do that. No one's going to say anything to them.
It's amazing, and veterans really don't appreciate being used as pawns, and he made us feel that way. One of the things that you addressed was long wait times, which we've seen for quite a while. We had what was a solution that was working for a while, which was the Mission Act we talked about earlier. And before COVID hit, we saw veterans for the first time getting health care outside of the system, and it reduced wait times and it reduced travel times. Where I live, we have certain veterans that might even have to go 8 hours all the way to Albuquerque, and they pass so many hospitals or clinics that could meet their needs. That was extremely successful, and post-COVID, and especially under the Biden administration, we've seen an undercutting of that Mission Act and that law. What are some of the things that you feel like the SVAC committee, HVAC committees on the House side, what can they do to oversee what the VA is doing?
And it's going to be important that we do that. I think that for veterans who chose to go into community care, the fact that you could just opt in and move forward with that during the Trump presidency was so exciting for them, because they got health care in the community where they lived.
Yes.
And that is so much better than having to seek out a VA that can provide whatever it is that you are needing and then get on a wait list and wait for it. That is no way to treat our veterans. And as you well know, I believe a veteran should be able to show that card, that there should be a universal insurance form that hospital, that doctor can fill out, file that claim with the VA, and then let's give them about 90 days to pay that claim back to that doctor. That's how you meet the obligation to our nation's veterans. But the fact that the VA, and this is all because of the unions there at the VA, they don't want community care. They want everything right there at their convenience.
The bureaucracy is more important.
Yes, it is all for the bureaucracy. It is not for the good of the veteran. So what we should do is remove the VA from the approval process and automate that process. I'm for bringing it online. Veteran can go online, fill out their form, say I am scheduling a primary care appointment at this physician at this time, and that VA gets that as their notification, and that veteran immediately moves into that community care for what they need. If they see a VA family doctor, general practitioner, and they say, okay, you need to go see a specialist for whatever it is, then that veteran should be able to choose that specialist that is closest to them at a time that works for them without having to go through months and months of waiting. We have veterans that die waiting for care because the VA is so broken, and it is these employees that are part of the union, and they're going to work on their schedule, not the veteran's schedule.
It's especially true when it comes to mental health care and suicide, to cancer from burn pits. The longer you have to wait, delayed care kills.
That's right.
Absolutely. Well, that brings us to the thing I'm excited about about the Veterans Healthcare Freedom Act. There's only one thing in the VA that works the way you described it, and that's urgent care.
Sure.
But the rest of the system is broken. Tell us a little about your bill and why this expands choice to a level where maybe it should have always been.
Well, and that's the deal, is it needs to be there for the veteran to make that choice of what is going to work for them. Now, I have some Tennesseans that are inside the VA. They've got their system set. They love it.
Yes.
You know, it's all good. But I've got a lot of Tennesseans that are coming into the process because of the burn pit, and I'd worked for years on toxic exposures and these burn pit issues because you've had a son at Fort Campbell. You know, we've got a lot of young men and women from Campbell that were exposed. And so giving them the freedom to choose without having to go through that VA referral process and wait for somebody to feel like today's the day I'm going to get after this stack on my desk and I'm going to begin to work through this.
Right.
You know, it is important to do that because, as you were saying, delayed care is denied care.
Yes.
And that really impacts the quality of life and the longevity of life that is there for our veterans. So let's take it out of the process and let's make this available for the veteran to choose where they want to go and how they want to get that care.
Putting veterans rather than the VA bureaucracy at the center of our conversations about veteran health care is so important. How can our viewers on this show support efforts to help get this very important bill passed?
Well, everybody needs to contact their member of the House or the Senate and say, vote for this, support this, because veterans don't want to be trapped in a system that does not allow them to access the care. I think it is such a false promise to say to our veterans, you have access to the queue, but not the care.
That is so well said.
You know, and they're stuck in the queue.
Yes.
And it's like being in a line of traffic, and the lanes are all blocked all around you, and you cannot get out. And that, in essence, is what is happening to so many of our men and women in uniform. So they need to burn those phone lines and burn that email up. Contact people, yeah.
Send those electronic.
You got it,
exactly.
Yes.
One last thing I'd like to wrap up with. Most representatives and senators I talk to, their caseload is just full of veteran constituent complaints. What can your office do to help with a veteran who has a
Well, I will
constituent?
say this. We have veterans that are on our staff.
Nice. Very
And we've got 3 of them on our Tennessee staff. They're in our state offices. When veterans call, we answer. And they can contact they can go to our website, blackburn.senate.gov. They can send us an email, they can grab a phone number for an office that is nearest them. We have 6 offices in the state, and they can reach out, and we have caseworkers that will gladly take up their case and work with the VA to make certain that the promises that were made to them the day that they signed on the line to serve our nation, that those promises are going to be kept.
Oh, thank you. Thank you, Senator Marsha Blackburn. Thank you for being our first guest.
Absolutely.
And I want to thank you all for joining us. Continue to stay tuned in the future for future broadcast series of congressional conversations. Thanks for watching.